Hi everyone, we're back, and this session's 30 for nurses 63 is called Medical Terminology in the Clinical Setting Part 2. The topics for discussion today will be ARDS, Adult Respiratory Distress Syndrome, its causes, management, ABG, arterial blood gas, DVT, deep vein thrombosis, PE, pulmonary embolism. So let's get started on the first topic. What exactly do we mean when we say ARDS? ARDS refers to Adult Respiratory Distress Syndrome. Here is the case of a patient, we'll call Nick, in the ICU with a diagnosis of pancreatitis, itis referring to inflammation. His own has been further complicated by ARDS, Adult Respiratory Distress Syndrome, and this is not uncommon with patients who have pancreatitis. Other causes include trauma, pneumonia, massive blood transfusion, sepsis, and there are many others. Anyway, we will focus on this ARDS at the moment. The lung tissue becomes very stiff and oxygenation becomes rather difficult. Patients are generally taken care of in the ICU, and mechanical ventilation, including medication, is all part of, the treatment process. The breathing becomes really difficult for these patients. White patches can be seen on X-ray on the lungs, which is the giveaway to confirm the diagnosis. Some of the tests that will be done to help with oxygenation is an arterial blood gas. This usually determines the amounts of oxygenation in the blood and how well that patient is oxygenating, and adjustments can be made by the doctor with things like medication and stuff that will help things or the ventilator settings to make things better. Next, we're going to go on to DVT. Here is Tammy on a long plane flight. She's been traveling for 2 days and is really tired. She has crossed 3 time zones. She's just exhausted and has taken very little fluids. Well, her trip is over and she suddenly goes to get her suitcase and notices she's got pain in the calf. How could this possibly happen? DVT, deep vein thrombosis. Well, all put together with the exhaustion, dehydration, pole leg movement, which is really one of the main things that causes this problem, will all lead up to this DVT, deep vein thrombosis. And it's unfortunate that on occasion it does happen that a clot known as an embolus breaks off and migrates to the lungs, resulting in something called PE, pulmonary embolism. Usually blood thinners are used to prevent, this progressing any further. So DVT and PE sometimes go hand in hand. A patient who has DVT is at risk for a PE. Now let's take the case of this other patient here. She's telling the nurse, "Nurse, I have a pain in my calf." What does the nurse say to her? "I'll see what you have ordered for pain medication." Well, let's put it this way. The most important thing, in my opinion, would be to do an assessment of the calf and see what's going on and take other conditions into account that may have led up to this. Maybe this patient was not wearing her TED hose or her sequentials, which is, of course, what helps if patients are, confined to bed from getting blood clots. Once a blood clot happens, it's very difficult because they have to be put on blood thinners. So prior to that happening, great care is taken not to get that far. Anyway, a pulmonary embolism. We've discussed DVT, the medical terminology, and pulmonary embolism. What would you expect to find in the patient with pulmonary embolism? Well, they may experience chest pain, shortness of breath, anxiety, rapid heart rate, tachycardia, that's the medical term for rapid heart rate, and coughing up blood, the medical term being hemoptysis. Diagnostic tests such as a VQ scan, which is a ventilation perfusion scan, is generally done to assist in diagnosing. A CT scan is also done in angiography. Well, I hope that you have learned something from these medical terms. However, right now, We are working on dearnurses.org, and the goal is to just help new nurses or nursing students or nurses who are just new to a topic. So if you can find time to visit dearnurses.org, and we're going to continue to expand. Have a wonderful day.